Cholesterol is a cargo being transported in trucks known as LDL particles. If the highway is smooth and well-maintained, the trucks move along without incident. But if the highway is damaged, inflamed, or susceptible to injury, those trucks start to crash. This is where that silent daily habit comes into play. It is a habit of excessive, non-stop glucose spikes throughout your morning routine. Most people start their day with a breakfast that is marketed as heart-healthy, but is actually a metabolic disaster. You might be choosing a sugary granola, a toasted bagel, or a fruit-heavy smoothie. Because these items are high in refined carbohydrates, they trigger an immediate and massive surge in your blood glucose levels. Your body responds by pumping out insulin to manage that sugar. When this happens repeatedly, day after day, year after year, it creates a state of chronic hyperinsulinemia. That excess insulin is a signal to your body to store fat, but also creates a low-grade, persistent inflammatory state in your blood vessels. When your vessels are constantly inflamed, your LDL particles, which are the main carriers of cholesterol, become much more vulnerable. To understand this, imagine your LDL particles are like glass containers. When you have high blood sugar and high insulin, those glass containers become brittle and prone to oxidation. Oxidized LDL is the real enemy. It is sticky, inflammatory, and much more likely to burrow into the walls of your arteries, forming the plaques that lead to cardiovascular disease. So, you can have a total cholesterol number that looks perfectly fine on paper, but if your morning habit is spiking your glucose and inflaming your vessels, those perfectly average numbers are lying to you. You are essentially creating a highway full of potholes and then blaming the trucks for the accidents. Think about how you feel around 11 in the morning. Do you feel a crash? Do you feel that sudden need for a second cup of coffee or a mid-morning snack? That feeling is a direct result of the blood sugar roller coaster you initiated at breakfast. Your body is struggling to maintain balance, and that struggle is biologically expensive. It drains your energy, increases your cortisol, and puts your cardiovascular system under unnecessary pressure. And here's the fascinating part. This cycle also impacts your triglycerides. When your body has too much sugar coming in, it converts the excess into triglycerides, which are fats circulating in your blood. High triglycerides often go hand in hand with low HDL, the good cholesterol that is supposed to clean things up. When your triglycerides are high, you think you are doing everything right by your heart, eating your oatmeal, taking your daily walk, and checking your lipid panel results with a mixture of hope and anxiety every 6 months. You look at those numbers, the total cholesterol, the LDL, the triglycerides, and you feel like you have a handle on things. But what if I told you that there's a single, seemingly harmless daily habit, something you likely do before you even leave your house in the morning, that is quietly sabotaging your cardiovascular health and masking the true danger lurking within your arteries? This is not about the obvious villains like bacon or smoking. This is about a hidden mechanism that turns your body against itself. And by the time we finish this conversation, you will understand exactly why your current strategy might be missing the mark entirely. If you want to take control of your long-term health and start making decisions based on actual biological reality rather than outdated myths, please click that subscribe button now and join our growing community, as your support helps us continue to bring this science-based clarity to those who need it most. Before we dive into the science, let me introduce myself properly. My name is Dr. Harrison Blake, and for the past 15 years, I have dedicated my career to clinical practice and research focusing on metabolic health and longevity. My goal has always been to simplify the complexities of medicine so that you can apply actionable, evidence-based changes to your life without being overwhelmed by jargon. My passion lies in helping men and women in their middle years regain their energy, clear the fog of chronic fatigue, and build a fortress of health that stands the test of time. I invite you to leave a comment below once we touch on the specific role of hidden inflammation in your blood work, because I want to hear how your recent results have compared to these concepts. Let's start with a fundamental truth that many people miss because they are too focused on the wrong target. When you look at your lab results, you are usually looking at a snapshot of your cholesterol levels. You see the LDL, often called the bad cholesterol, and the HDL, the good cholesterol. You feel relief if they are in the green zone, but the mistake most people make is equating these numbers with total safety. Cholesterol itself is not inherently evil. It is a vital building block for your cells, your hormones, and your brain function. The problem is not the presence of cholesterol. It is the environment in which that cholesterol exists. Think of your arterial wall as a highway. They actually interfere with the effectiveness of your HDL, making it less efficient at doing its job of protecting your heart. It is a triple threat. You have the vessel wall inflammation caused by the insulin spikes. You have the oxidized LDL that is now prone to sticking to those walls. And you have high triglycerides that effectively bench your HDL players. All of this can happen while your total cholesterol levels remain comfortably within the range your doctor considers normal. This is why standard blood panels can be so deceptive. They tell you the amount of cargo, but they do not tell you the condition of the highway or the cargo packaging. To change this, we must shift our focus from just lowering the number to improving the quality of the internal environment. How do we fix this? The solution is simpler than you might think, but it requires consistency. We need to stabilize your blood glucose from the moment you wake up. Instead of starting your day with carbohydrates, I want you to start with protein and healthy fats. This is a cornerstone of metabolic health. When you eat eggs, avocado, or a high-quality protein source, you do not trigger that massive insulin surge. Your blood sugar remains flat and stable. This prevents the inflammatory response in your blood vessels, protects your LDL particles from oxidation, and allows your energy levels to stay consistent throughout the morning. You will find that you no longer need that mid-morning snack. Your mental clarity improves, and the chronic fatigue that you have been blaming on age or stress begins to fade away. People often ask me if this means they have to give up all carbohydrates forever. The answer is absolutely not. It is about timing and quality. If you want to enjoy a piece of fruit or some oats, have them after a meal that is rich in protein and fiber, not as the first thing that hits your stomach when your insulin sensitivity is at its peak. By delaying your carbohydrate intake and prioritizing healthy fats, you are essentially giving your body the fuel it needs to function without triggering the inflammatory cascade that damages your arteries. This is the difference between surviving and thriving. Let us consider the role of exercise in this equation. Many people believe they can exercise their way out of a poor diet. They go to the gym, push themselves hard, and think that justifies the bagel they had hours earlier. Exercise is wonderful for your heart, but it cannot override the metabolic damage caused by constant insulin spikes. Exercise increases your insulin sensitivity, which is great, but if you're still feeding that insulin spikes loop, you are essentially fighting a war on two fronts. The best approach is to combine the metabolic stability of your nutrition with consistent, moderate movement. A post-meal walk of even 10 minutes can significantly blunt the glucose spike of whatever you just ate. It uses the sugar in your bloodstream for immediate energy rather than allowing it to circulate and cause damage. I have seen patients in their 60s completely transform their health markers by making these small, calculated adjustments. They start by changing their breakfast, adding a short walk after lunch, and ensuring they have adequate protein at every meal. Within 3 months, their triglyceride levels drop, their HDL starts to rise, and, most importantly, they report feeling decades younger. They have more endurance. Their mood is more stable, and the constant, nagging anxiety about their next blood test disappears because they finally understand the mechanisms that drive their health. We must also talk about the psychological aspect of this journey. It is easy to feel defeated by health news that says everything you do is wrong. I want you to reject that feeling. This is not about failure. It is about empowerment. You are gaining the knowledge to interpret your body signals correctly. When you feel tired, you now know it is likely a metabolic issue, not a lack of willpower. When you feel anxious, you know that diet-induced cortisol spikes might be the culprit. You are taking back control from a system that often prioritizes short-term comfort over long-term vitality. Let's look at the numbers in a different way. If you have a triglyceride to HDL ratio that is high, it is a much better indicator of cardiovascular risk than your total cholesterol number. A healthy ratio is often considered to be below 2. If you have your last blood test result handy, calculate that. Take your triglyceride number and divide it by your HDL number. If that result is above 3 or 4, it is a clear signal that your body is struggling with metabolic flexibility. It is a sign that the hidden habit I mentioned, the morning glucose spikes, is likely at play. Once you see that number, It stops being about abstract health concepts and starts being about your reality. I would love for you to share in the comments section what that ratio looks like for you, as it helps other members of our community see that they are not alone in working through these metrics. Understanding your health is a lifelong process of learning and refining. You are not meant to be a slave to your lab reports. You are meant to be the architect of your own wellness. By choosing to step away from the cycle of refined carbohydrates and toward a foundation of stable blood sugar, you are making a commitment to your future self. You are deciding that you want to be active, sharp, and full of life well into your later years. This is a path to longevity, and it starts with the very next thing you decide to put on your plate. Do not be discouraged if you have been doing things the other way for years. The body is remarkably resilient. It is constantly working to repair itself, provided you give it the right environment to do so. Every meal is a signal. Every day is a fresh start. You're not defined by your past habits, but you are absolutely shaped by your current choices. Start small if you have to. Swap the morning bagel for a vegetable omelet. Take that 5-minute walk after your meal. Notice how you feel. Pay attention to the subtle changes in your energy and your focus. These are the victories that compound over time. As we wrap up our time together, I want you to remember 3 key takeaways. First, your total cholesterol number is not the whole story. Focus on the quality of your blood and the health of your vessel walls. Second, your morning routine is the most critical time of day for setting your metabolic tone, so prioritize protein and healthy fats to prevent insulin spikes. Third, use your own data, like the triglyceride to HDL ratio, to monitor your progress and stay on the right track. You have the tools to change your health trajectory starting today. Consistency is your best friend, and curiosity is your greatest ally. If you found value in this explanation and want to see more content that cuts through the noise and provides real, actionable, science-backed guidance, please take a moment to like this video and share it with someone you care about who might be struggling with their own health markers. Your engagement truly matters, as it helps the algorithm push this information to others who could benefit from a clearer path to wellness. Remember, the journey to a healthier heart is not a sprint. It is a culmination of daily habits that stack up to create a life of vitality. You have everything you need to start that journey right now, and I am here to help you navigate it. Thank you for your time, your dedication to your health, and for being part of this community. Stay focused, keep questioning, and keep moving toward that better version of yourself.